This is Kayleigh Kovage with Sanctuary TV. We're here at the New York State Capitol today, where concerned citizens have rallied their support for Single Payer Healthcare Lobby Day. Is healthcare a human right? If so, then why is U.S. healthcare a for-profit industry? Why do 45 million Americans go without the treatment they need, while our broken, out-of-date system remains top-heavy with executive compensation? These are questions all Americans deserve the answer to. Speaking with us today are Dr. Andrew Coates of Albany Medical College, New York State Senator Neil Breslin, Reverend Harlan Ratmeyer with Albany Medical Center, and commentator Dr. Richard Propp. Also with us today is uninsured wife and student Stephanie Gurkis. Stephanie will tell us about the nightmare she's endured trying to navigate the U.S. health system without insurance, all while being a student, working, and trying to get the care she deserves, which is why we've gathered here today to ask for, demand single-payer health care for all.
Thank you. Hi. I wasn't expecting to be the very first person up here to speak, so you just have to bear with me. My name is Stephanie, and my husband and I drove here today from the Ithaca area. I'm a student, and I'm a wife, and I'm a personal trainer, and I'm uninsured, and I have a kidney disease. And since 2004, I've navigated my way through this convoluted healthcare system, trying to get the basic things that I need to ensure that I'll continue to live, which is what it comes down to. I was insured for a while when I first became ill, and I was really lucky for me because I had a lot of tests, and luckily we were able to figure out what I have. But I guess I'm just standing in front of you today to say that I am uninsured. I am a contributor to this society. I'm a student. I'm trying to do my best. I try and stay healthy. And it's not enough. It's not enough for me to do my best. I need health care. I need to see doctors. My health care is rationed. There are tests that are not ordered, and there are specialists that I don't see. And I find myself a lot of times standing on a ledge wondering what's on the other side and wondering about my health in all, even though I try to keep myself well. And this just isn't right. I shouldn't be left out of the dark. I'm not a bad person. I didn't do anything to deserve this disease. It was just bad luck, I suppose. So I guess I'm just here today to say that humanity cannot afford to continue private coverage for people. This is the civil rights movement of our generation, and for-profit industry has no place in a just healthcare system. Thank you for hearing me. Single payer now.
Senator Neil Breslin has been thinking and working on this issue for a long time. Please welcome him to our rally.
Thank you very much, Richard. After Sandy spoke, I think everyone here says that says it all. Healthcare is a matter of right. Healthcare is a matter of right. And for those 45+ million across this country, and for those 2.8 million in New York State, and throughout a year, it's not 2.8, there's 5 million people who at some point don't have any health insurance. That's wrong. But who would have thought 2 years ago that we'd have a president who supports universal health care? And who would have thought 2 years ago that we now have a New York State Senate that has that as their principal focus, universal health care? I never thought I'd see it on the horizon. I thought I'd be working in the trenches for someone else to do it. Let me tell you, we will all see it, and the sooner the better. So keep up the work. I applaud everything you do. Thank you very much.
A good person, Andrew Coates.
Thank you very much. Well, first of all, I'd like to recognize the New York State Nurses Association. Thank you very much for coming out today, the New York State Nurses. We know that they mobilized their huge membership to be alerted to today, and we know that they're keeping the backfires burning in all the home districts. They have an apparatus and have thought about this. We're delighted that we can join physicians and nurses, labor activists, and patient rights activists, and others together. Today, I think that we're at a stage, we've said that another world is possible, that we can have a system that actually has everybody in and nobody out. But we haven't really started to articulate our imagination. And when we come to the New York State legislators, we come to the governor, we say in New York State, imagine what it would mean for property taxes. If the county didn't have to have Medicaid, if everyone was covered by one system, what would it do to upstate property taxes if no one needed Medicaid because everyone had health care? What would it mean for the county's budget if they didn't have to purchase health insurance for their employees? What would it mean for the school district's budget if they didn't have to purchase health insurance for their employees? What would it mean for property taxes? It would mean a radical restructuring, the exact kind of relief that we need. And what would we get as a side effect? Health care for everyone, comprehensive health care. H.R. 676, the bill in Congress, is being treated right now as that kind of off the table. And some of our best activists in the country have raised the cry, the single payer needs to be on the table. We need a voice. It's a very peculiar situation because the majority of people want single payer. The majority of Americans believe that health care is a human right. The majority of doctors believe that we should have national health insurance. The majority of nurses who are at the bedside know well what it would mean to have health care. We don't believe that people need health insurance. We believe that people need health care. And now we're having a definition in Washington that if everyone somehow has insurance, that's quote unquote universal. But we know that if you have insurance, it doesn't amount to getting care. It amounts to a rigmarole, a game where the insurance companies try to extract as much as they can, and every bit that they're successful in extracting from the system in the way of profits or overhead or advertising is resources that do not go to health care. What's happened is a very strange thing. There's a pearl of wisdom in Washington somehow that taxing the health benefits of people who have good health insurance coverage is the way to pay for the ones that don't have it. Well, that's going to turn out to be a putrid pearl of wisdom. That's going to backfire on the leaders of the country. There's another pearl of wisdom that somehow criminalizing the uninsured, like they did in Massachusetts, making a law that says you have to buy health insurance is going to lead to universal health care, and that's going to backfire on the leaders of the country. There's another pearl of wisdom that says that people want to keep the good health insurance they have. And that's an especially putrid pearl because we're fed up with the health insurance we have. We're fed up with CEOs who make up to $24 million a year, while this year alone, 9 million people, according to the Wall Street Journal, 9 million people lost their health insurance because they lost their jobs in the last year because of the recession. Some of those people got Medicaid, some of the children got S-chip, but 9 million people lost their health insurance. So when they quote that 47 million number, it's way, way, way over 50 million. We have a crisis that's unfolding. It will continue to unfold. I agree with the speakers that this is the civil rights struggle of our time. Health care is a human right. Our movement will continue to grow, and we will win single-payer national health insurance in this country.